There is a question regarding what is osteoporosis in regards to what you're describing, Mr. Keshe.
Ask them what do they call osteoporosis.
I can put a picture of the bone structure on the live stream.
No. Ask what is explained as the osteoporosis in world of medicine. Define it, or has it been defined? Maybe Elia can explain to us.
Yes, osteoporosis is the less level of calcium in bones. And then they start to be more fragile and easy to be broke. And have different kind of levels of osteoporosis, depends of density of bones, and have devices where they measure the density of bones. And depends of the level, they started from osteopenia, and then when the level go up, this is some kind of measurement of the density of the bone, and then separate to the up to 4 or 5 levels. So the first is osteopenia, and then started osteoporosis, first grade, second grade, third grade, and so on. And mostly osteoporosis related with less level of estrogen, and the age of the woman when she reached the climax age up to 40, 45, 50, when the estrogen levels go down, started to get symptoms from osteoporosis, and the normal treatment in traditional medicine, they give it the calcium tablet with estrogen. So the traditional medicine believes that estrogen hormone helps to storage calcium in bone. Do you need more explanation?
Can you explain it around what age does this happen?
When the woman reach the climax, when the period menstruation just stopped, mostly related with that. Or if something is wrong in the hormonal homeostasis in woman, I mean the hormones which related with reproductive system of the woman, or if some diseases related with genes.
Do you see this mainly in men, or is it just in women?
It is so rare in men. Actually, they get the osteoporosis if they have hormonal disbalance also, or if they use some kind of diuretics. This is the drugs which make the urination, increase the urination, and they mostly use it when they have heart diseases, which is related with dysfunctioning of the pump function of the heart. The name of this diuretic is spironolactone, if someone use it, just to know. And spironolactone is like diuretic drug, just increase estrogen level in the man, and actually also they have it gynecomastia. I mean, the glandule mame, the chest just growing like in a woman. Mostly it's related with that in men, but it is so rare. Actually, calcium impact, traditional medicine belief, is related with estrogen.
Can you tell us which bone usually get affected by this?
Hip. They measuring hip, and also they measuring sacral part of the spine, And now they have a new kind of scanners from osteoporosis, and they use it the vertebra also. They have to have density, these bones. It's not that much spongy.
But it's mainly traditionally connected to the hip bone.
Yeah. And
Okay.
sometimes they measure in the heel also.
Yes. Okay.
Yeah.
The reason for this scientifically is again goes back to the allocation and the point of need. During the menstruation, the body, as I've explained in other parts of the workshops, the body looks for what is available, needed for the conversion in the fetus, and somewhere where everything is near to. As I said, body, each bone has its own usage at the point of need is being placed in that way. During the menstruation cycle, every time that the body gets ready to give life, as I said, and I explained this in a lot of my talks, is that the body provides everything for the party. It doesn't wait till the party, the guests arrive and then going looking for, but makes everything available ready that when, if the inception comes and the fetus is produced or started, everything is available for the fetus. Part of this is calcium needed in the form of the GANs, in the form of ready produced, absorbed gravitational magnetic field plasma. Where is the womb of the woman? In the cavity of the hip. So in the cycles, 12 times a year, the body takes a ready converted, what we call like a animal we chews, or the mothers we chew the food, and then they give it to the child because it's ready, can be digested. The body, the brain instructs the structure, the hormones and the rest of the operating part of the reproduction cells to go to places and take what is needed for the party for production. And in the structure of the life of the woman, the hip is the closest place where large amount of calcium can be deposited and can be used in the soft tissue immediately when it's needed every month for the inception of the child. So every month the body takes a piece out of the hip, and this creates cavities, this creates weaknesses. So these are the holes. These are the what they call osteoporosis. This is the every time, and that's why men do not reproduce. Women do that in the womb. So as part of the cycle of the menstruation, every time the body goes to the bank, to what you call it, the storage place where you have already converted calcium, which is in the hip, and brings it ready into the womb, in the structure for the child to be born, that is ready in the plasma of the lymph of the mother, that for the child to have it ready for it to be used. So that's why we see this disease only with women, and we see it in the, what they call it, the porosity of the bone. And if men go through the same cycle, we'll have the same disease. And partially we see it in the spinal cord, in this, what they call in the spine, in the lower spine, in some cases, and on the top of the upper bone of the legs, is through the same process. When the body is weak, this process, there is not enough calcium available from the hip, so the structure goes further up to where it's soft. Calcium is ready for it to be ready for the menstruation, for the cycle of the child to be born. In the case in 2005, 2004, 2005, we have shown that we see the same kind of structure of the prosody and the weakness in the man when the prostate cancer goes into the hip. The same side of cavity, weakness of the hip appears itself to show. And through the process we developed, we have managed to literally link up or seal or allow the body to reproduce calcium in the area of the hip to strengthen the head. So in cases with a new understanding, you can produce, we've done this in 2 occasions as a trial. You create a condition where through like a seat, you create an environment that in a way like a bone fracture, where the calcium comes when you have a broken bone and it heals, or you don't. The healing is that you make a connection between the 2 sides with a new calcium, so you don't get a straight fusing. It's like a lump on the point of the fracture. We have seen in the X-rays and MRI done in the hospital in Holland that we get these prostheses like filled up with new calcium, but it's not filled up. It's just like it's like a little hill, little mountains that the calcium come and get trying to cover the hole. And in that process, we've seen the strengthening of the hip bone. So this disease comes only through menstruation and through because the body, the brain instructs the body to have a ready available calcium for the birth of a child. And it happens mainly in women, and now we see the movement into the spinal cord and even on the upper legs, what do you call it, the upper bones of the leg. It's just totally because of the diet which is changed, and there is not enough right calcium plasma available for the production of the child, or what do you call it, the birth of the child to be supported. So softer tissues further up on the internal side of the spinal bones are used, and we see that in that kind of process. So it is, with the new present knowledge, this the hip can be what you call supported by the allowing, creating an environment that you create a false environment that the body changes the lymph calcium into the calcium which has got the right gravitational magnetic field on the bone structure of the hip. And we don't see this with any other more or less what do you call it, condition. It only happens because the womb of the mother or a woman sits within that environment near a soft available ready calcium, which is the hip, and it takes from it, so it makes indentation on it, and this indentation becomes like a porosity, because as you take it out, it does not get replenished by the same what do you call it, same kind of calcium, because by the time it comes, it's like our nanomaterials, another piece is already built on it, so the cavity stays. The creation of capacity prosody with this disease is very much can be explained like in nano layers. If the scientists look at it, is position, whole position. So the new calcium covers the top of the old hole and the material, so the hole in between stays. It's like a little grooves which Elia showed us in the structure of little cavities in the bone structure. This is only to do with the reproduction cycles, and that's why it's connected to the hormones. Because it's connected to the estrogens and the hormones, because your optical gravitational magnetic field trigger comes, that there's a time for a cycle of the birth, that triggers the what do you call it, the release and absorption of the calcium from one point and release to the fetus in the womb of the mother. And when the menstruation cycle stops, there's a disturbance in this, and then the prostheses are there. There is nothing can be done because the holes cannot be refilled. There is a misconception in the world of medicine, in a way, of public, is that when your physical menstruation is finished, everything else in your body stops regarding the reproduction. It's not so. Even though you don't go through the menstruation cycle, the body still goes and picks up the cavity and the hole, create the holes, but because the hormones are not there to reorder the, what do you call it, the filling up order, you start seeing these holes. So if you're 90 years old and your menstruation stopped when you were 40, the holes are still getting made in past 50 years every time your menstruation cycle month has come. And that's why hormones has a direct, because the right hormones, in a way, when you are young, in the process of menstruation, orders the body to fill up the gaps, or at least repair the gaps or cover them. When you get to the point of what you call the menopause, there is a disturbance, part of the information is lost, the body does not replace the holes, doesn't fill up. And then you see it as you see it, prosody and weakness in the hip, and then the hip fracture. And usually with the hip fractures, then it comes that through the poisoning of the, depending how the skin of the bone has been damaged and it's been interfered with. And then that caused partially through the poisoning of the blood. Elia can explain to you when it happens, when the content of or chemicals from the bone are released into the bone structure, into the blood circle. Next question.
Mr. Keshe, I had a question regarding that. How would the emotional part of the brain, or what some people might call the essence, affect that porosity with that bone problem? Can it be affected somehow through the emotional part of the brain once the damage is already done?
Depends where it is and what it is. They call it sometimes brittle bone. For example, if you have prostheses or you have weak bones, you have to understand what has caused that in the structure. Not everything is emotionally based, but emotion have an effect on part of the operation, which does not release the right information for the bones to create the right vibration to convert the lymph into the calcium plasmatic gravitational magnetic field.
So could someone change their attitude or their belief system, or somehow do some kind of meditation or something?
Partially, maybe yes. Partially, in a way, no, because it is built into your DNA, RNA base.
Okay, would prayer
sometimes it can be helped, and somebody can trigger it.
Would prayer help, either doing it with the person doing it or someone doing it for them?
I don't know.
Okay.
I cannot answer you that.
It's pushing
No,
it
you
too
don't
much.
go and break. You don't go break your bone and sit in there and pray, now heal, because my emotional side says you heal. You can create a condition to speed up the process. It's very easy. You can. We had this discussion with Elia, and I've explained this before. You can create conditions that, in a way, the environment that allows the production of the calcium for repairs or increase of the conversion of the lymph into calcium at a given point in a given condition. As I explained to you, I've done that to myself in my own case about 4 years ago. And it's well documented, and it's been everywhere. I broke 10 ribs, and within more or less 7-8 days, there were no sign of fracture. I mean, there were signs of fracture, but all the fractures on the broken bone ribs were totally, what do you call it, healed up. You can't, because the technology, the knowledge is there. I've done it for myself, and every process has been documented in the hospital. You can do. You can create condition to change the condition of brittle bone or speed up the process, but you got to be there when the skin irritation and the cut of the blood vessels on the skin of the what do you call it, on the point of the fracture are fresh. Then you there, because of the activities, you increase it, and then you can allow the conversion of the lymph into calcium in a very, very rapid way. And he uses a very, very, very low gravitational magnetic field current flow. If in the near time we'll show this, as Arman is producing a smaller and smaller reactors. In the coming time, we show you small reactors which you can, as a set, as a system, you can put at the point of fracture, and you can heal up the broken bones within a matter of days, hours.
Would that
But
be with
again,
would that be with a direct application, or would it be with the fields around the object that would be used?
yes, you create the same, what you do, what your bone does inside the bone to convert the convert the plasma within the limbs to calcium to become part of your bone, because the oldest piece of your body is your thymus, your, what do you call it, your femur, which is 9 years old, part of it, and that's due totally to its mass and its size. Because even the calcium in your body has a life cycle, and it gets absorbed, it loses its life cycle, gets absorbed, and get what do you call it, disposed of through your disposal system. But you can create the same kind of vibration and plasmatic gravitational magnetic field at the point of the fracture, at the point of the break, at the point of the creation. So you can create gravitational magnetic field where the amputation has taken place for a leg, for example, in the future, that it creates gravitational magnetic field of what do you call it, the calcium of the bone of the amputated position, and you allow the bones to grow, because the information coming from the brain for the development is there, and it gets responded back to, and you grow. This is how we grew the toe 5 years ago, 6 years ago with the lady. The pictures is well documented, is on the internet. But it's just trying to teach in a coming, now that we start the medical side, at this moment for the next few months, we try to call the theoretical part. And then we start teaching how to make these systems. How to be able to do these systems, that physicians can do it. Hopefully we'll receive more doctors and people who understand both sides of the mechanical, electrical, and the plasma conditions and the medicine, or what I call the biology of the man. Then they can build the system much easier. We have started, as you know, this process now. Now we are working directly with doctors who slowly I'm trying to teach to take over. We have a number of doctors around the world who will start monitoring their volunteers, monitoring the process of the volunteers, and then I start teaching them how the system works, and then how to build the systems for different occasions and problems. This is the same thing that in the bone structure, any bone, you call it a bone cancer, or the secondary bone cancer through what do you call it, through other cancers. These all can be reversed, can be allowed to be reversed, and the new fresh bone calcium to be produced at the point of need. Where you see what has been damaged or been softened through, lift density to the calcium that is become the strength of the matter and the calcium level. Then you understand in so many ways why when a man dies only bone is left behind, because the bone conversion in the calcium is in a specific way very much near, but not exactly, near enough to um, the calcium structure under the atmospheric gravitational condition of this planet. That's why it does not get dissolved and stays as a bone. I have written a paper why the bone of the man stays behind in the majority of the cases unless the field's condition are changed, which then it like flesh, this what do you call it, dissolves back into the gases. There is a direct connection in how and what and the way the bones stay behind, and they don't, that's the only bits we find as calcium as the man exists.